The Health, Housing, and Justice Alliance was formed through the Clinical Scholars COVID Relief Project in order to both eliminate inequities of virtual services during the pandemic and to promote interorganizational coordination across three service sectors: healthcare, social services, and criminal justice. Through two strategic planning meetings, we scheduled pop-up navigation centers throughout Newark, New Jersey. Purple dots represent our 6 outreach events, which were held at 3 sheltering or transitional housing programs, 2 public parks, and 1 transit hub. The green dots represent our 2 court pop-ups, which were held at a local community center and the public library. In all, we were able to check in 84 people at our HHJ events, likely serving more as it took a few events to create a working service flow. Over half of the people served had issues within the legal system they wanted to resolve. Health screens revealed urgent medical issues that we were able to address. And housing continues to be the most requested service, but also the most difficult system to navigate. Almost all individuals requested help in more than one sphere, reinforcing the idea that intentional cross-sector outreach versus a singular health fair or agency-specific canvassing can most effectively attend to the variety of needs that people are navigating in the moment. We relied heavily on local advocates and service consumers to establish trust within the community. Participatory budgeting allowed us to work directly with community members when designing and conducting our outreach. One community member who was part of the HHJ explained how he convinced skeptical people to attend events. I was listening and took a chance to give them information to get the help that's going on and is being offered. And they see that it's legitimate and it's no gimmick. We learned that frequent, low-touch events proved extremely effective. Large-scale events can take a lot of pre-planning coordination, and when attendance is very high, providers do not have much time to speak with people who come to them beyond a quick rehearsed blurb and the sharing of a flyer. But over just 6 two-hour events, we served at least 84 people across different neighborhoods, demonstrating that these regular, smaller efforts were still able to bring in a wide range of people. For the 84 individuals who we met, HHJ partners completed preventative health screens, scheduled primary care appointments and court dates, checked for warrants, and completed intakes for housing programs in the moment, ensuring strong initial connections to providers. It was important that these events felt like a collective that was working together, as opposed to tabling events, where agencies might be in the same space, but they're focused on their specific corner. We found that having universal materials for the event was helpful for both the consumer and the agencies when building this type of connection. Each person who came to the outreach event received what we called a participant packet, which was a waterproof pocket folder with a passport divided into sections: health, housing, benefits, legal, and other. All agencies added their information to the participant packet, creating continuity across all of our events. Moving forward, participating agencies are working to integrate the HHJ outreach efforts into existing stakeholder networks. Over the summer, we will host 3 information sessions and develop resource materials for both the criminal justice and medical communities, exploring how legal involvement factors into a culture of health. Clinical scholars across 2 project sites will introduce attendees to the social determinants of health, explore racial inequities in addiction and justice, and discuss how these HHJ partnerships improve service delivery for all people, including the court involved. This project has shown that when partnerships are purposeful, interdisciplinary, and community-driven, the whole is greater than the sum of its parts. And it's our plan to share that information to anybody who can benefit from it. Thank you.